All right. Hello, everyone. I'm glad to be able to present in this great conference. My name is Szymon Sacher. I am a PhD student in economics at Columbia University. And this is a joint work with my somewhat more senior co-authors, Andrzej Szymonov, who is assistant professor at Columbia Business School, Jean-Pierre Dubé, who is a professor at Chicago Booth, and Szymon Biswas, who is just starting at University of Washington. The title of this talk is The Persuasive Effect of Fox News, Non-Compliance with Social Distancing During the COVID-19 Pandemic. You might guess that when we released it, it was somewhat controversial, not unlike the research of the great keynote speaker. It's still under review. Economics journals are notoriously slow in reviewing, therefore it hasn't been published yet, but it is available in a working paper, and I will give a link at the end if you want to have a look. So as the title suggests, we are going to look at social distancing. I'm sure you're familiar with it, but just to make sure we're on the same page, social distancing just means staying away from one another, perhaps staying at home. It has been recommended by the Center of Disease Control at least since March 10th. And it's been said that social distancing was the only strategy against spread of COVID-19 until pharmaceutical innovation would appear, such as a vaccine or for a new medicine. So while there was general agreement about social distancing being desired, researchers have identified a number of dimensions, social demographic dimensions, along which social demographic groups varied in their compliance. Some of these dimensions include things like income, internet access, ethnic diversity, and these are related, for example, to the types of jobs people do. I think there is one additional talk in this great conference about that issue. So this might be difficult to change. However, there's also a perhaps more concerning aspect of these differences, and this is the political preference dimension. Notably, researchers have found that people in more Republican regions, places that voted for Trump, are more likely to go out, less likely to stay home, generally have been less likely to practice social distancing. This has been attributed to the differences in what politicians said about the pandemic, or continue to say about the pandemic, especially in early stages back in March. In particular, some people emphasize the role of that media might play in shaping people's beliefs and preferences, and therefore their behavior. A survey back in April by Pew Research found that people that watch Fox News were much more likely to believe that the coronavirus was man-made rather than appeared naturally. They were also much more likely to believe that the vaccine would be found by the end of this year. And they're much more likely to say that media have either extremely or severely overestimated the seriousness of the pandemic. So motivated by that, we are going to try to understand the role that Fox News' coverage had on differences in behaviors. Why Fox News? Well, for starters, this is the most viewed television channel in the US. And I want to emphasize, this is not the most viewed cable channel. It's not the most viewed news channel. It's the most viewed television channels in the US. Not only that, but it presented and continues to present very different coverage of the pandemic than the other major news stations such as CNN or MSNBC. I just gave you a few quotations here, and I want you to look at the last one from March 15th, where the presenter argued that it was a great time to go out to a local restaurant since you can get a seat easily. Bear in mind, March 15th is long after CDC recommended social distancing to everyone, and even after President Trump announced a nationwide state of emergency due to coronavirus. This distinctive coverage resulted in civic groups filing a lawsuit against Fox News, alleging that they misled their viewers and insisting that a court should compel Fox News to present a different coverage of the pandemic. In light of that, our research question is simply stated as, does exposure to Fox reduce compliance with social distancing? And if it does, whether the effect is due to its distinctive coverage of pandemic, or perhaps some long-term effect of showing that in scientific evidence, etc. We're going to compare Fox News's effect to effects of other news channels, specifically CNN and MSNBC. But as a preview, I can tell you that the other two didn't have a detectable effect. You might ask, well, why care? The answer is, I think, pretty simple. It's been argued that there is a trade-off between health and economic implications of the pandemic. Perhaps more people now believe that there isn't actually a trade-off, but some people still argue that there is. The argument is that more social distancing, more aggressive actions by the governments will perhaps improve health outcomes, but they will surely worsen economic outcomes. So if Fox News might be able to compel viewers to go out more often, that can have detrimental effect to health, but may or may not help the economy survive and recover. More broadly, though, we want to connect this paper to emerging literature on defiance of science and expert advice, even when stakes are high and there is little scientific doubts about an issue. Example of such papers include papers on vaccination by Lewandowski and co-authors, on global warming by Chmielowski and co-authors, and even hurricane evacuations by Long et al. All of these papers find that Republicans in particular are less likely to believe the scientific advice and much more likely to doubt the scientific recommendations, etc. Now, why is measuring Fox News effect, or more broadly, measuring media persuasion effect challenging? Well, that's because viewership is not allocated randomly. It's not that there is no experiment that we can do to ask particular people to watch Fox News and others to watch CNN and look at how they behave subsequently to that. In addition to that, viewership is strongly correlated with other factors that may impact behavior, social distancing, and compliance in particular. These factors include geographic location, income, age, population density. Some of these factors may increase compliance with social distancing, such as age, but others, such as rural location, may reduce compliance with social distancing. So disentangling those effects is not a trivial task. So to overcome this issue, we are going to borrow an idea from Martin and Yurukoglu's 2017 AER paper, American Economic Review paper, that uses quasi-random variation that is generated by the fact that US media market is fragmented. There are a lot of different cable systems, and in those cable systems, particular channels are located in different places. This variation is not driven by any underlying preferences, but instead by timing when channels were introduced in particular areas. So we are going to show you that the variation exists. Then we are going to show you that the lower position, closer to zero position, tends to lead to higher viewership. So we are going to isolate the differences in viewership caused by differences in position and nothing else. And then when we establish those two facts, we are going to see whether this exogenously varied viewership causes changes in social distancing compliance. For this strategy to be valid, we need to first show that the positions are uncorrelated with other things that strongly predict social distancing. And we show that the positions are in fact uncorrelated with income, education, population density, etc. So we are generally confident that this variation allows us to identify the Fox News effect. Our data on social distancing behavior comes from the company called SafeGraph. Much like the previous speakers' data, this data is also available to many groups of researchers, including economists, epidemiologists, etc. We're going to look at a few different outcomes, or I should say it's a big panel, it's about 8 million devices observed every day. Our main outcome of interest is going to be the share of people that didn't leave their home location, so share of devices at home. And we see that this measure increases substantially around the beginning of March, basically increases from about 22% to almost 40%, and then decreases slightly as people get tired of staying at home, lockdowns are relaxed, etc. For channel viewership and positions, we obtain data from Nielsen. Nielsen measures channel viewership. We are going to use data mostly from 2015 because we have a full coverage of the country, but we obtain a subset of so-called DMAs. For March for period between March and April, because the data we couldn't obtain the full data. Nielsen's methodology changed. We're going to focus on the November 2015 data, but because viewership is highly persistent, we are confident that that data is telling us a lot about current viewership. In addition to that, we are using the data on channel lineups, and on the graph here, I'm showing you the variation in the position where particular channels are located. We see that there's a substantial variation where three major news channels are located. I promised to show you that the position matters for viewership, and this is what this table is showing. Our preferred specification is in second column and shows that higher position leads to less viewership. To give it in interpretable unit, we need to scale the so-called rating points, which is the unit that Nielsen uses, to time, and we find that one standard deviation change in Fox News position is associated with approximately 25 additional minutes of Fox News watching per week per household. So this is not a small effect by no means. It's about 15% of average. Our main empirical model is going to regress various social distancing outcomes on zip code fixed effects, time-specific time-specific trends, competitor channel time trends, differential demographic trends, etc. And our main object of interest is this channel time-specific effect of viewership, beta CT. As already mentioned, the main concern, however, is that we cannot really do this simple regression because we are concerned that the unexplained variation in social distancing, denoted by zeta ZT, is correlated with rating, i.e. the viewership. So because of that correlation, if we simply run this regression, we would mismeasure the effect of viewership on social distancing. Our solution is in essence, plug channel's position in place of channel rating. And argue that the channel position is uncorrelated with these unobserved factors that affect social distancing. If we literally do this, we are going to obtain what economists call reduced form regressions. And I'm showing you this reduced form regression on this graph. We see that beginning in early March, the higher Fox News position, the more social distancing there is. Recall that the higher position also means lower viewership. So
5 minutes.
Yeah?
You have 5 minutes left.
That's fine. Yeah. So one standard deviation increase in Fox position leads to 1.7 percentage points lower social distancing. And if we translate it to viewership, we see that 1 rating point increase in Fox News viewership reduces social distancing by 9.9 percentage points by March 15th. To have more interpretable units, we again change rating points to minutes, but perhaps it's easiest to interpret it in terms of percentage. So a 10 percentage point rise in Fox viewership leads to approximately 1.3 percentage points lower social distancing. Let me skip this in terms of time. So just focus on interpretation. We in the paper show that the evolution of the time varying effect of viewership does not align with business closures, etc. So interpret it as not being driven by business reactions, but rather consumer reactions. Then we compute what economists call persuasion rates by looking at how many people could have been swayed to practice social distancing or not. And depending on the outcome, we look at these varies between 6 and 28%. The lower number is for share of people going to work. I think it makes sense because there's less choice whether you go to work or not than whether you go out, say, to a shop or a bar, etc. So the higher number is for staying at home. This number is a bit higher than, it's on the higher end of previously found estimates, but it's not out of line with what other research found. So to conclude, we document persuasive effect of Fox News by stripping the variation in viewership due to other effects and simply focus on this, what we call exogenous changes in viewership. And we find that 10% extra viewership leads to social distancing decrease by 1.3 percentage points. In the context of pandemic, suggests that exposure to Fox News does really have health and economic implications. But more broadly, we argue that exposure leads to people making choices and defy expert advice in the framework or in the setting where the choices really matter. So unlike political preferences, where there might be a genuine disagreement, there isn't really disagreement about among experts about the pandemic. So the people respond to media, not the experts, means a lot to us. And that would be me. So if there's any question, I'm happy to answer. Oh, thank you very much. The paper is available, and my contact address is here if anyone wants to ask any question over the email.
All right, great. Thank you. One question I had is, what do you see as the next steps from your work?
It's a good question. We would ideally want to publish this paper. We might at some point try to obtain better data on viewership, but in general, we are generally happy with the results and the current state of the paper. So I can't think of anything in particular right now, although there is obviously a lot of research to be done about why people make decisions they do. Some people argue that we should look at particular messaging that was differentiating Fox from other channels, and that might be something that we would look at later stages.